Welcome to the Navigating Dental Insurance Podcast, where we don't take from insurance companies. Here are your hosts, Mr. Jordan Comstock and Mr. Ben Tuine.
Welcome to another exciting episode of the Navigating Dental Insurance Podcast. I am your host today, Jordan Comstock. We are without Ben today. He is traveling again, out staying busy, speaking out there at dental conferences. So Ben, if you're listening, we miss you and wish you could be here, but good luck out there speaking, man. Today, I have an exciting guest. Her name is Joann Leon, and we met Joann through our good friend Debbie Bitkey. And Joann, her experience is working with insurance, obviously. That's why she's on the show. So Joann, you're with Dental Practice Solutions with Debbie, correct?
Yes, I am.
And tell us how did you get in dentistry, and how long have you been in the dental world?
I've been in the dental world about 39 years. It started back in 1977.
Oh wow, nice. Very cool. What got you started? Did you have family in the industry, or what attracted you to the dental industry?
Well, what attracted me, I went into a small town, and there was a dental office that had an ad out for a receptionist. Myself not knowing any better, I just recently was married, and I needed to work in order to help, at the time, my husband. So I went in and I applied. And at that time, the dentist would train people, give training on the job, and that's how I started out. I started out as a receptionist, and from a receptionist, I graduated into insurance billing and verification, and from there, a treatment coordinator, and from there, as an office manager, from an office manager to a dental consultant.
Awesome. And from earlier our conversation, you said you're still managing some dental practices, right? Was it four?
Yes.
So
yes, I am.
Managing 4 dental practices, that sounds like it keeps you busy.
Yes, I am very busy. Yes,
So you manage 4 practices, and then you are a consultant as well with Dental Practice Solutions. So very cool. How did you get connected with Debbie? She's like awesome. I love Debbie.
I love Debbie too. And I was looking to grow my business, and being in a not like a small town, and in Bakersfield. Uh-huh. And so I went online, and I did get my certification as a procedural auditor consultant through the California Association of Dental Plans. But I needed a little bit more of how to master and how to charge out my hourly rate, where I am not doing all this work mm-hmm. and possibly training others. So I looked online, and I contacted, it said, Debbie Bitkey Seidel, and it said, do you want to become a dental consultant? Please join the Master Academy of Dental Consultants. And that's how I got acquainted with her back in 2014.
Oh, awesome. So just through the networking group there. Very, very
yeah.
Cool, very cool. And then you obviously went and started. You help with like negotiating insurance. What other things you help with with your consulting?
With the consulting, basically, I enjoy training the front desk, also the doctors and the back office assistants on the correct procedure codes for the services that are being rendered, and also helping them to understand the process of the insurance and how there's so many different insurances and many groups where they fall into different categories, and how to program their computers from EagleSoft to, Easy Dental, Dentrix, and then also what does the insurance company, say for instance Delta Dental, most offices are contracted under Delta Dental. It's kind of a forced, because if you're not, then if you're out of network, the patient, does receive the payment. So they're kind of forced to join Delta Dental. And what are the guidelines that Delta Dental, utilizes? And so I go in and I train the staff to get familiar, to know the groups, how to program their computers from the, upgrades, and because the systems of the computers are kind of preset, but if you learn how you can kind of manipulate the computer, where it can obviously give you the deductibles on the single x-rays or the downgrades, from the composites to amalgams, the crowns. Most offices are doing all ceric crowns or all porcelain ceramic crowns, and you can program your software to give you kind of the exact amount that the copay is going to be for the patient.
Oh, cool. So you help with that system, and you help set those up in practices. It always seems like a ton of practices have issues setting those up, because I remember even going just to practices, in my history of dental work needed. It always seems like they're always off when they they tell me. So I'm sure that's a huge problem in the industry. So that's pretty awesome that you help with that. So let's get to this real quick. I have some questions that I want to ask you that will help our audience understand how to manage dealing with dental insurance. So my first question is, what do you find in a practice when they have claims rejected or denied?
What I find is that either the procedure code that they are billing, it's either deleted or it's not the correct. Sometimes, like tooth number 20, they will, the assistant, because most, like 90% of the time, the assistants are trained to go into the charting and to push this little button that someone before them, and then that person before them, anyhow, set it up, the explosion codes or the multi codes. And what happens, they push this button, and what happens with that tooth number 20, they're probably billing that out as a 2330 or that's for one surface, where that is a posterior tooth, and it should have the 2391 if it's a one surface billing. So those kind of things get them confused. Also, the crowns that somebody probably set up, like I'm saying, they're utilizing like all the porcelain base metal code, which is the 5751. And here this doctor is doing all ceramic crown, which is the 2740. And so those do not match up as when they're getting to send out the claim. Also, the bone grafts. The bone grafts, I went into an office where they were, billing out as the 40, I believe it was the 4263, which is the bone graft when you do osteosurgery. That's the gum surgery. And they were billing it out when they were extracting the tooth, which should have been the 7953. And some 953. However, you cannot utilize that 4263 on the osseous code of that surgery for that bone graft, because it's an incorrect code. Yes, it does pay you a lot more money, but the insurance company is not going to, they're asking, well, when did this person have the surgery? And here you extracted this tooth, or you're placing the implant, and the implant, you're going to do the bone graft at the time of the implant placement, and that's not the 7953, that's the 6104. So those things like like Premier Access, it's an insurance company, and sometimes on the x-rays, that the the occlusal may not show, and they may not want to pay you. So when you have a company like United Concordia, Premier Access, or Guardian, and you're doing occlusal surface, why not take that intraoral picture and submit it so you can get payment? Because, even though you're trying to do the research why this was denied, time is money. So
Absolutely,
if you get it right, when you get it right in the very beginning, and the guidelines of each insurance, and you prepare yourself, then using your electronic billing, then there's no reason why you're not receiving those claims within 7 days for payment.
Awesome. No, that's very helpful. Why do you think so many practices, and this is kind of a follow-up question here, why do you think so many practices struggle with managing all the insurance claims and just working with insurance companies? I just want to know your perspective.
What was the question again?
So I just want to know, why do you think so many practices struggle with working with insurance companies and getting this system down right?
First of all, it's the owners. They have to take responsibility where they have failed their employees, because they're looking at their numbers and they say, I'm just going to throw this person in, and it happens all the time. And I tell my clients, you have to give them 2 weeks of intense training for this position before they become live and they start interacting with your patients. Because what happens is that person, first of all, myself, I've been 39. Every doctor is different. The way they do things, they process. Okay, so it's going to take me some time to adapt of their way of doing things. Imagine someone that is not fully trained, and basically in dental, they learn from the person or the other office they were working with. They only know very little, but they don't understand why you do certain things a certain way, and why the insurance, asks for this, information like your perio charting, your full mouth x-rays, make sure the apex is showing, or you're going to do a crown and the cusp is showing. Don't cut it off and send that out because they're not going to pay you. And so the office, the provider, the owner is not willing to invest.
I see.
Their thing, what they say to me is that, Joann, I really don't want to invest this much money or time into this person, because this person, if I train them and I give them the knowledge, and I use you as to train this individual, how do I know after the 90-day probation period if this person is going to stay with me?
Good point. Yeah.
And I said, doctor, you can't afford it, but you can't not afford not to. And in the process of this 2 weeks intense training is like going to boot camp.
Yeah, totally.
And so your investment of them going live is getting your claims processed and your money's collected, because the way you've been doing things, and you have, 40,000, 100,000, 200,000 out there in the AR that is not collectible, hey, why not be open to someone to train and educate them the reasons why you do what you do. And then, doctor, you can't hold someone, hey, and if those 90 days, they processed your claim and they went to the person across the street for $1 more or $2 more, hey, you repeat it, and you're collecting most of your money.
Yeah,
it's a long-term investment, know.
It is a long-term investment, and you can set money aside, to invest in that, as you go. But I do think I'm a big believer in in the business owner understanding all the systems and processes in a business. And I think obviously managing insurance, as much as I'm not a big insurance fan, I'm going to be honest here. I think insurance is you're definitely going to use that to help attract patients to your practice, but it's definitely very smart to understand the processes and systems dealing with insurance. And I think when the doctor and the practice owner understands those and understands the systems and or the education to teach his staff how to be really efficient, it's going to make his business even better, and it's going to make patients happy and instead of mad that their copay is higher than what they quoted or anything like that. So, which leads me to my next question: Why do some patients? Why do you think patients complain about their bills? Right, we see this all the time. Give me your thoughts here.
The reasons why they complain about the estimate being incorrect, and it goes like this: if you have someone, and I want to say something. I do agree with you. We should be in the industry fee for service.
Yep.
Because the insurance has so many guidelines.
Too many sometimes.
Too many. Yeah. And they dictate to you what you can and cannot do.
Yep.
As far as now, X-rays having deductibles, single PAs, or the limited exam may have a deductible, or the buildup is inclusive with the crown prep.
It's crazy.
That's the insurance world.
Yep.
But what happens is in the offices that are contracted with insurance companies, which could be Delta Dental, MetLife, Guardian, Aetna, United Concordia, those are kind of the big companies out there. So what happens is that either what failed is that you have someone that's inexperienced. The computer, say Dentrix or EagleSoft, the contract fee was not connected with that insurance company. So if you're Delta Dental and new doctors, if you're not, back in my time, been in practice for 30 years, you're grandfathered in for your premier fees with Delta Dental. However, new graduates, new people are under the PPO, the DPO, under Delta Dental. So that right there, you have to connect your fee schedules into the program. The other thing happens, say that this patient had composite fillings. So if your program is not where you have placed the upgrades into the system to the payment table of how much they would allow for the silver fillings, and you don't program it, then what happens when you send the claim out, the patient, they are going to have a higher copay. What happens is that, like, say, for instance, Aetna is a stickler. So Aetna, if you didn't propose the benefit of their policy, which is in fillings, let's say restorative fillings, and it's their benefit is for the silver fillings, and the upgrade would be composite. If you did not disclose that, they will tell you you cannot charge the patient the difference.
Wow.
You have to know the insurance. So that before First Dental Health, like I'm in California, there's a lot of state of California employees that have CCPOA, the correctional officers insurance. When I went into this office, you have these CEOs very upset.
Yeah.
Because at the time, CCPOA was not paying on composite fillings. It only happened maybe 3 years ago. I may be off, like 3 or 4 years ago, and that they allowed composite fillings with, not downgrading them. And so you have these CFOs because they have, the piggyback. So if they were going to pay 90%, you would think that the piggyback would pay the other 10%. Well, that was not the case with the composite fillings. So I think they must have had so many complaints from these CEOs that now, they went and they changed the policy that they would cover. That's one thing. The other thing could be if, like, say, your periodontal deep cleaning, which we call replaning, or we call, SRPs, or, the 4341. Well, if you're dealing with United Concordia, Guardian, Premier Access, Humana, Blue Shield, Blue Cross, Anthem Blue, if you're not submitting the periodontal pocketing, which sometimes they fail to do, and say that you do, and say you don't have current x-rays, which are 6 months to present, what happens is that they're not able to determine that bone loss. So so they get denied. And if you know that these insurances are very rigid regarding processing those claims are going to be denied. And I see that time after time after time. Like United Concordia, if a person's under age 30, most likely 99.9, those claims are going to be denied. Mm-hmm. So you have to really get to know the insurance. So the patient, you provided the service, the patient gets the statement. I mean, you're not talking about $20. You might be talking about, $200, $400, because this procedure got denied. So, and I mean, what does that say about your office? It's a catch-22. Yeah. Because on the patient's side, they see you as being incompetent.
Yeah, I agree there.
You really don't know what you're doing, and then with good faith, they trusted that this claim was going to go ahead and get paid. So the best thing is to do is know your insurance companies and what they suggest. And my time, I always say pre-op. Take those, and when you're probing and you're doing your periodontal pocketing, you see bleeding, snap that picture. Mm-hmm. Send it to them. Take a picture, of all that buildup. Document it. Yes, I said, because that's going to help you speed up the process, and they're going to allow it. And then the other is the crowns. If you're doing all ceramic crowns, and they're downgrading, say MetLife downgrades to the 2791, which is a base metal crown. Well, in my
which is a very low quality crown, in my opinion. It's really low quality.
Yes,
bad.
Yes, it is. Yeah, and you're doing that on the posteriors or the molars. Well, they're going to downgrade, and yes, if you didn't calculate the difference, that the difference is maybe $75 difference or $50 difference. We're in the economic stage right now that people are wanting to hold on to, their money. Yeah. And they want to, either have the option, should you get permission, because I want to know exactly to the penny what I'm going to be, paying as my part. And then, you get into, well, we have the third party financing. And so, they agree, but then they get this, bill, Yeah. I would be upset too.
Yeah, absolutely.
I would be upset too.
Yeah, and the hard part is that insurance companies do complicate how we manage our practices, because they make all these guidelines and rules and all this stuff.
Yeah,
And
yeah.
I can totally understand how frustrating it can be with working with insurance. So growing up, my mom worked with insurance companies for her dental practice. Well, she still does. I don't know why I said was, but she I remember that it can be really frustrating working with all the many different PPO providers out there. So thanks for that. Thanks for that information. I think that was definitely helpful. So I have another question for you. Why do some insurance companies reduce payouts to the practices?
Oh, that is something that all the owners for the companies or corporates, whoever's in control of their fees. If you are submitting, say that you're submitting your claims with the, your usual reasonable customary fee that you charge, if you're having that on the claim form, which I do recommend utilizing that. I know some offices believe in you. Let me give you this one scenario. So say that you don't take a look at all of your insurance that you're contracted under. Some people are contracted, for some are 10, 12. It's it gets very ridiculous because, if you're like 12, more than 4, then what
crazy.
You're doing, what you're doing, and these owners do not know is that they will pay you because they partner and they network. So you don't know who's under Aetna or MetLife or Emeritus, so they will pay you, and if they partner with the lowest one, they will give you that fee, the lowest fee.
Mm-hmm.
And so you have to really know who you're partnered up with. Anyhow, going back to the usual reasonable customary fee, if you don't look at each contract of all the procedures that you're contracted with and your fee of the UCR, what happens, let's take, for instance, Delta Dental. And say that you're, let's say, maybe a crown.
Okay.
And your that contract fee, like in Kern County, it's $698. Okay. And say that your usual reasonable customary fee is $800. There's no problem with that. Where the problem is that these doctors that are under the Premier, they're grandfathered in, is if their crown is, I just have this, if their crown is 810, and that's what they're utilizing as their 810 as their UCR fee, and say that this First Dental Health is paying $856. Well, that $810 that goes on the on the claim form, and your contracted rate of the $856 with First Dental Health, what shows on the claim form $810, that's what they're going to pay. Whether it's 80% or 50%. So that's the mistake that's being made.
Interesting.
Or the insurance company, like Emeritus, if you're contracted with Emeritus and you don't go in January of 2018, or you didn't go January of 2017, and they kind of basically give you like a few cents or a dollar increase on certain procedures, and you didn't go in there and check and update that, and you're not keeping up. So what happens, they're going to pay you, and you're utilizing the fees that you have under Emeritus claim form. Well, they're not going to pay you more because you made the mistake. Okay. So if your crown is $600 and they gave you an increase of $620, and you're utilizing, 2 years ago, the contract of Emeritus to submit your fee for that company, then that increase that they did, they'll only pay you the percentage off of what's on that claim form.
Interesting, very interesting. Yeah, No, I think that's definitely some useful information for our audience here. So, what are some other common like misused codes that you see out there in a dental practice?
The common misused codes is that sometimes the front desk or chair side make is knowing what are the anterior codes versus the premolars, and when they're going to do the restorative, fillings, they get that mixed up with the anterior codes, the 2330 versus the 2391 or 92. They get get kicked out. The buildups. They either the doctor did a buildup and they're billing out as a post. They're utilized instead of utilizing the 2950, they may utilize the 2952, which is a custom lab, which the fee is greater, but you didn't send that that post to the lab. Or they utilize the 2954, which is a prefab post, where the doctor did a 2950, or vice versa. They did a 2954, and they're coding it as a 2952. Okay. And so that's kind of things that I see. I see that the bone grafts, many offices make this mistake. The bone grafts that I normally see is the D4263. Well, the 4263 is, yes, indeed, it is bone graft. However, that is done when you do the osteosurgery. And you got to remember, the secret to it is look at the code. If you see it begins with a 4, those are going to go under the periodontics.
Oh, interesting.
The 4,000 codes. Yeah, and if they did an extraction and they placed the bone graft, they'll use the 4263. So the insurance is saying, well, when did this person have this surgery, this gum surgery? And when they have this tooth pulled, you did an extraction, either a 72, the 7210. And you're placing the bone graft. So the correct code for at the time of the extraction would be the 7953, and it falls under the 7,000 codes, right? Mm-hmm. So if you're extracting the tooth, it's in the 7,000 codes, and you're placing at the time of the extraction, that you're going to use the 7953. It's in the 7,000 codes. Now, if you're doing an implant, so because they changed the codes for the implants 2 years ago, I believe, and so this 6104 would be at the time of the implant. You wouldn't put at the time of the implant, the 7953. The clue is it's in the 6,000 code. So if you're doing it at the time of the implant, and that it's 6010. That look underneath, and you'll see that the 6104 would be the appropriate code. And doing that, the other thing, it's the crowns. The doctor. Well, they always say, well, I'm gonna be charging more for, I have the CEREC machine and I'm doing CEREC crowns. Okay.
Yep. Okay,
I understand. Well, we have this special code for our CEREC crown because costs more for the convenience, and I agree. I mean,
absolutely,
what you want to charge, I said, but it still falls under the 2740. It's an all porcelain ceramic crown.
Mm-hmm. Yeah.
No, but but I'm doing a Brexir, or I'm doing an Emax, or I'm doing, it's a name brand, but it's a 2740. It's all ceramic crown. I mean, if you're going to charge for the upgrade, that's different. However, the appropriate code would be the 2740. So those are things that they kind of
so
get,
many codes.
Too many codes.
There's too many codes.
Yes.
How many codes are there?
Yes.
Do you know how many?
Oh, well, they go up to the 9,000 codes.
Wow.
So each category has about 20, from, the diagnostic. I think the preventative codes have the less codes in there, but the restorative, they fall into your crowns.
Yeah, crowns, dentures, all that stuff.
Yeah, there is a lot of codes there, to kind of get familiar. However, we probably use about 20 codes on a unit that's repetitive.
That's pretty common, yeah.
Pretty common, yes, in a general practice.
Awesome. No, this has been very helpful information, very interesting. But every time I hear how it really is working with dental insurance, it makes my brain want to explode. And I think that's why I'm like pro fee for service, becoming a practice that's less dependent on PPOs. And I mentioned to you earlier about kind of what we do in the industry and help practices create in-house membership programs or dental savings plans with our software. I like that because it's a lot more. It's pretty simple, right? You don't have to memorize all these codes. Well, I would hope they don't memorize 9,000 codes. That sounds like well, if you're doing that, you probably have a ton of time on your hands. But that's a headache, it seems like to me. But what I want to get your opinion about becoming fee for service. Do you see the offices that you manage, they have some fee for service aspects to them, or what are your thoughts on becoming fee for service?
I agree. You, as a person that is myself, I'm self-employed. There's value in your knowledge, your education,
Absolutely.
the time that you put into. And however, doctors, dentists, especially, they're afraid.
Yeah,
they're afraid because they know that I say we, the dentists have done this to themselves because they've taught patients to not care about their well-being, but to be more in tune of what their insurance will help them to.
Yeah, more price conscious.
Yes, price conscious. And in the medical field, you wouldn't even blink twice if you're sick and you go.
Absolutely,
and you have to pay, there's copay. So we need to start re-educating our patients and see the value in the education and what we can do, because most of all, most of the diseases that happen, begin in the mouth.
Absolutely.
And so if we educate the value of why this is urgent and not postpone, because if you postpone because you say you have this insurance that's $2,000 and you maximized it for 2017 and you're phasing out the treatment because obviously the patient can't afford to get it all done, then, they're waiting. But, also on that wait time, it just, when you have something that is extensive, where it's a 3-surface, 4-surface filling, it's getting close to the pulp, and then you may require a root canal and a buildup and a crown. Well, what happens, it's going to cost you more at the time that you wait versus had you know that here's a coupon, from Nordstrom's or Macy's, and I'm going to utilize it, and then I'm going to take care of what I can, for this year service. And if you're offering these discounted plans, then it's more in favor of the patient, because I'm aware of the cost. However, if you are able to provide this service for patients, they're saving on the long run. They're saving time from taking off from work. they're saving from, not ever experiencing, dental pain.
Yeah.
Or, or where, if you let things go, where they progress and it's going to cost you more time and more money. And so it's good to have insurance, but the bottom line, you should know what's best for yourself.
Absolutely.
And, utilize programs that are available there where, doctors are utilizing your program where they're able to save on the cost and can help them out,
Yeah, absolutely. And if you do the math too, working with PPOs, it's a very expensive marketing campaign if you think about how much discounts you give. I believe discounts are good, but they do cross a line if they're too much, in my opinion. It could affect profit margins and the overall health of the business, right?
Yeah.
My recommendation is when practices are working with insurance or want to reduce dependence on PPOs is to understand your numbers, because that's bottom line. We are all in business, no matter, if you're a consultant, if you're a software company, if you're a dentist, we are all in business, and numbers are very important to understand. And I think it's very important for a dentist and those that are managing to understand, each procedure costs and how much you can really discount and still make a healthy profit margin so that you can continue running your business and helping those patients, right? So that's my, I guess, thoughts of just if you're going to work with dental insurance, understand your numbers, put a floor in place where you can't discount below it, right? Because if you discount below it, then you're going to be losing more money. The same goes if you're wanting to go fee for service and maybe start and grow a healthy in-house membership program. You got to understand your numbers so you can understand what types of discounts you can afford to do to take, right, and still make money.
Right.
So I'm a big believer in the obviously the fee for service model because, like I said before, insurance has always given me a headache. As a patient, it's given me a headache, and then obviously in the industry, it gives me a headache. So, Joann, I am so grateful for you to coming on our show today and sharing your expertise with our audience. I think this was a good amount of information for them, and I hope that it's definitely useful for them. If any of our listeners want to contact you with questions, about working with insurance and about some of the systems that you talked about, what's the best way they can contact you?
They can contact me, Joann, Joann, at dentalpracticesolutions.com, or they can contact Kate, which she is our manager for Dental Practice Solutions.
Cool.
And the number is 949-351-8741.
Awesome. And that's dentalpracticesolutions.com, you said, as well, is the website? Yes. So go to that website and check them out. Debbie is one of our good friends, so she's got some great resources for everybody. And Joann, thanks so much again for coming on the show. Do you have any final thoughts before we end this episode?
I would like to thank you for giving me this opportunity to speak, and also, just if you are a practice, and I do understand you can't turn things over ASAP, know your insurance companies and please train your staff so this way you can see the value where you can utilize this product that can save you lots of money, and you're able to go into a fee-for-service practice.
Awesome. Perfect. Thanks so much, Joann, and I hope you have a good one.